everybody to our
This
Chase.
meeting is being recorded.
There you go. Welcome to the Chase webinar. This is part of our monthly series, of course, of webinars. And today we will be learning about the topic of healthy materials. This is also a CEU accredited webinar, so that's really good for the designers out there, of course. The presentation will be 45, maybe 50 minutes. And we'll have a question period afterwards. By all means, if you have any questions, put them in the chat room. We will be monitoring that and ask your questions towards the end. Or, you always have an opportunity later on to ask the question live. So as I mentioned, this is a CEU accredited webinar. If you registered and provided us with your ID CEC number, we will get that registered for you and process your credit within the next 5 business days. As you may have heard, we are recording this session and it will be made available on our website within the next 72 hours at chaseoffice.ca/events. If you want to have access to it, please let us know. I also want to talk about our next webinar that will be coming up fast, June 2nd, and that will be on a Thursday as well, with the topic biophilic design. Nature in the workplace. I think perfect combination with what we're doing today. And let me introduce our speaker today, Alexandra Ramundi. Did I say that right?
You did. Yes.
Alexandra, welcome. Alexandra is an A&D rep in Toronto for Humanscale. She has a degree in interior design from Ryerson and has been in the commercial interiors industry for over 5 years. And Alexandra is passionate about helping designers and clients bring their vision to life. It's her show. She has the slides. So I'm going to hand it over now to Alexandra with the topic, healthy materials.
Yes. Thank you, John Paulo. So I'm really excited to give this CEU. It's one of my favorites to give that we have at Humanscale. I'm going to turn off my camera, share my screen, and kind of jump into it. Let me just get sorted. Are we good? Can we see my screen?
Yes, we can.
Okay, perfect. So that as mentioned, this is an accredited IDCEC CEU. If you haven't provided your information, please do, and we'll make sure that we get you registered. So the whole concept with this CEU is some key takeaways from this presentation is understanding how materials impact health in the environments, understand the EPA's research and outline the role of transparency in selecting healthy building products, highlight key chemicals of concern in the furniture industry in particular, and then explain how to incorporate healthy materials into LEED well and LBCD and other projects that your designers might be designing with your clients. So why are we having this conversation? We spent almost all of our time in the built environment surrounded by manufactured products. It's not surprising that the chemical ingredients used to make these products start to impact our health and the health of our environment. Some people think, I don't eat my furniture, so I don't need to worry about its chemical ingredients affecting my health. But since we're surrounded by these products almost all the time, it's not surprising that we find these chemicals in our bodies. There are a few different ways that the chemicals get released from the product. Volatilization, abrasion, so meaning scratching, scrubbing, scuffing away, leaching, so released directly into the liquids such as water and oil. So lead pipes is a good example of leaching. Oxidization is the metabolical process which occurs with the reaction like burning and rusting. Once chemicals are released, there are a number of different ways that our bodies can be exposed to them. One, inhalation, so breathing them in. Ingestion, directly eating or drinking the food that is contaminated. Absorption, which is a global term that describes the transport of chemicals from the outer surface of the skin, both into the skin and into the systemic circulation. Dermal absorption can occur from occupational, environmental, or consumer skin exposure to chemicals, cosmetics, and pharmaceutical products, absorbed into the skin through oils and hair follicles, and then prenatal, absorbed from the mother through the placenta or through breastfeeding. So CFCs seem to be an issue from a long time ago, and we have been regulations phasing out into the industry. But it's a good example to understand why direct exposure is not only starting to place the understanding of healthy materials. So the direct impact of the material specified on the people who will be using the space can easily be highlighted. However, this isn't the full picture. A next step to consider is the indirect impact, which can be just as harmful. So CFCs are a good example of indirect impact. They were designed not to be harmful to humans. The molecular doesn't interact with the human body, but it does float into the stratosphere, destroying the ozone layer and causing many people to get skin cancer from sun exposure. It had significant impact on the health of many people, not through the direct exposure. And sorry, I should have said CFCs stand for chlorofluorocarbons. Another example of a dangerous chemical is the hexavalent chromium known as Chrome 6, the chemical of concern in the movie Erin Brockovich, which a lot of us, I'm sure, have seen. It doesn't often and may not come off of products into the office environment or can be absorbed through dermal contact. And we may want to think that because it's not manufactured next to us, we won't be affected. But chemicals used in manufacturing spread through the water in the air to be found everywhere. Recently, the Environmental Working Group has found it unsafe and has found unsafe levels in over 95% of US drinking water. We may not always know the exact pathway of these chemicals that get into our bodies, but we would be wise to continue to use them and consider them in our surrounding environments. So these are just some potential health effects that can happen to us when we are exposed to chemicals: asthma, cancer, autism, infertility, premature birth, and obesity. So how protected are we is the question. There is an assumption of the government protection, particularly in the US. And sorry, I should have prefaced this at the beginning. This is a certified CEU that does pertain, to the US, and I can't tailor it, but they are our neighboring country, and a lot of similarities are, what one government does is very similar to what we do in Canada. So there is a lot of crossover. So as a result of the 83,000 chemicals registered by the EPA, only 200 have been evaluated and only 5 had been partially regulated. There are many chemicals with known health impacts that are still in use, and many others whose health impacts have not been evaluated. Other laws, such as those setting air, water, and workplace safety standards, do not adequately regulate exposure to most chemicals, nor do they address the hazards of a chemical may pose over its life cycle. So again, as I said, out of all 83,000 chemicals, these are the only 5 that have been regulated, which is pretty crazy to think. Precautionary principle is a theory of risk regulation that shifts the burden of proof on the safety and provides a valuable framework for preventing harm to human health and the environment. The principle sends a clear message that the manufacturers must research the health and environmental risks of their products before harm occurs. It does not call for the elimination of all risks, but through burden shifting. The principle legitimately asks risk creators to justify the risks they impose on society. The precautionary principle advocates common sense and states the evidence of harm rather than the definitive proof of harm should prompt policy action take place. For example, the FDA, the Food and Drug Administration, requires that any new substance be tested extensively to demonstrate that the chemical is safe before using it. The burden of proof is on the manufacturer of the chemical to demonstrate that it is safe. However, it only covers food and drugs, not all chemicals that get introduced in the marketplace. Other chemicals are regulated by the EPA, which does follow a precautionary principle. Industry groups such as the American Chemistry Council argue that risk assessment should place the burden of proof on public regulators to demonstrate that a chemical has a detrimental impact before any regulatory action is taken. And I think this is a really great graph showing like lead paint, for example, which we're all aware of and its harmful effects. That took almost 21 years to identify that there was a risk with lead paint. And then it took 21 years before a regulatory action was taken. And then if you look at lead gasoline, it took 66 years. So it's pretty crazy to think how long it takes for a problem to get identified and then for something to happen. So how do we apply the precautionary principle to manufacturing to make better products? So you want to look at the inventory. So find out what are all the chemical ingredients in a product. Screening, evaluate the ingredients against known lists of hazards. Publish, make all of the ingredients in their hazards public information. Verification, have a third party verify the chemical ingredients research to make sure it's thorough and accurate. And then we want to assess. Green screen assessment identifies which chemicals are of most to least concern to better understand and avoid regrettable substitutions. Optimize, remove all worst in class chemicals. So that would be red list chemicals, subsidiary of high concern in the US, they have, in Europe, they have REACH, which identifies any chemicals of concern. And we're going to go through each of these. So importance of transparency. Allow people to make informed decisions when purchasing and specifying products. It builds incentive for manufacturers to improve their products and allows further research about the impacts of specific chemicals. Note that some certification review chemicals without requiring the manufacturer to publicly disclose them. So cradle to cradle is an example. And facts, these are not as effective at causing industry change because the manufacturer is still able to keep those chemicals of concern private. So again, we're asking for them to make those chemicals of concern or whatever they're using in their products public information so we are aware. So what is in a product? So let's look at a task chart, for example. You have a part. Let's look at the seat. The materials, if you break down to the textile, and then this is the composition of just that textile. It's made up of nylon and a list of other materials and ingredients. So in total, there's 57 unique materials and 157 textile options. So to claim that we know all the ingredients in the smart, for example, with our chair, the smart chair, we went through the series of conversations 214 times when we account for all options and components that are included in that smart chair. Gathering the material ingredients can be a sufficient challenge the first time a manufacturer goes through the process. However, once you build this into your business practices, include it in our supplier negotiations and contracts, and make it a requirement for production, we have a systemic way to gather the information. Building that system takes effort, but it then just becomes a way of doing business. When you ask for the material ingredients to be disclosed, it's very powerful because it gets manufacturers to change how we do business. Some manufacturers claim the amount of work and intellectual property are impossible barriers to overcome, but it's more like their products contain chemicals of concern that they don't want to tell anyone about, or even more reason to ask for the ingredients. Reporting on chemical information can be complex since displaying and communicating all information can be complicated. Each company did it differently. It would be impossible to figure them all out. There are two standard formats that make the reporting simpler. They work in the same way as a nutritional label, always shows the information in a standard format, making it easy and quick for people to understand. So a declare label answers 3 questions. Where does a product come from? What is it made of? And where does it go at the end of its life? Declare is a transparency platform and product-based database that is changing the material marketplace. It means it's meant to be a customer facing, so it's intended to be simple to read. There's a key at the bottom that allows you to show if the product is declared, which means over 99% of ingredients have been publicly shared on the label, even if some ingredients may not be optimal. Much like a nutritional label, it does not confirm that the food is healthy, it just tells you what's in it. This is the first step and will be very valuable. LBC compliant, so living building compliant, over 90%, which means over 99% of the ingredients have been publicly shared. Less than 1% of it has not been publicly shared, although it has been evaluated for hazards and it's kept proprietary. And then a red list ingredient is included on the product, but an exception is made by the ILFI because it is impossible to manufacture the product without it. And that's why that red list is kept in, and that's why it's declared LBC. So both HPDs and declare labels publish the material ingredients, while declare labels are intended to be simplified and public facing. The HPD reporting system was developed as a platform to gather data in a rigorous scientific format so that toxigenists, manufacturers, and architects could have a database to process and process in specific ingredients in an open forum. The information gathered by the HPDs can be fed into a declare label or other platform to create a simplified public-facing version. It is extremely useful for all manufacturers to be gathering the information in the same way. So HPDs is a valuable standard. The HPD is an open standard and is a standard specification for the accurate, reliable, and consistent reporting of product contents and associated health information for products used in the built environment. The HPD open standard specification is harmonized with programs of International Living Future Institute, Cradle to Cradle Product Innovation Institute, Clean Production Action, LEED, WELL, and BIFMA, and a growing number of other ratings and certification standards in the building industry. HPDs are information heavy, because it includes all of the ingredients, and each ingredient's health alternatives do not exist. Red list free is 100% of ingredients are publicly shared, and none of them are red list ingredients. So declare labels and HPDs are both self-declarations. Manufacturers gather the information and publish it using this standard format so that it's not confusing to understand. There are no certifications and the information is not audited before publishing. Because these are open platforms, the industry is responsible to an extent to police itself. In 2018, a third-party verification program began for both HPD and declare labels. During the verification process, an outside auditor reviews all the information and confirms that it comes from an original material formulator. Screening against lists of hazards, like red list chemicals, is a good starting place. It gives a binary, so meaning good or bad, view on each ingredient, but some chemicals can be more impactful or more hazardous than others. For example, 2 different chemicals may show up as on a hazard list, but one might be much more harmful than the other. A much more thorough evaluation involves understanding the nuances of different chemistries and their context of use. The green screen for safer chemistry systems rates each chemical from a benchmark of 1 meaning avoid most concern, to 4, excellent, no concern, and outlines a systemic way to review the relevant scientific literature, if any is available. This assessment is generally done by a toxigenist. Green screen or other toxicological assessment dives deeper into the chemical properties and evaluate them against human and environmental toxicity. For example, a full green screen assessment involves a comprehensive data review and modeling for mismeasured data. classifying hazards and hazard levels for each hazard endpoint. So for an example, that would be with carcinogens, reproductive toxicity, and that's just to name a few that they're evaluating. As is typical, progress is non-binary. While comparing chemicals to a red list is a great first step, taking products through a deeper screening process, such as green screen, can help shed light on regrettable substitutions. Chemicals of concern are often replaced with new chemistry. Because the EPA isn't able to thoroughly evaluate new chemicals, these can often be just as bad or even worse than the chemical they replace, and often are new enough not to fall in a particular red list. So a great example is BPA is known for an endocrine disruptor. So it messes with your hormones and systems. And it has been linked to a number of health issues. When people found out that BPA was not good for them, they tried to avoid it. And many products were made BPA free. I'm sure we've all seen that labeled places. However, the chemical BPA was often replaced with was BPS or BPF, which have the same basic chemistry family and shared the same health concerns. So BPA was replaced with BPS and BPF, which is really no better than BPA. So there's necessary work to understand the ingredients of a product and their impacts on health, and only first steps and ultimate goal on creating optimized products. Products that use no chemicals of concern, including regrettable substitutions, are important. On an HPD, this is indicated when the product has no benchmark ingredients and materials have been fully disclosed. On a declare label, this is indicated when the product has a status red list free. So there are several red lists out there, but the most common is the ILFI red list, which is shown up here, and it includes 14 chemical families and about 800 unique chemicals on the list. There are other red list hazards. For example, the REACH program in Europe has a list of substances of very high concern. California Proposition 65 kept a list, which is continually updated. Customers may have their own specific red list, such as, design firms such as Perkins and Will has their own red list or chemicals that they try to avoid. These lists include many, but are not all of the same chemicals. The ILFI red list provides a good encompassing list that applies to the building industry. So in bold, these are some common occurring red list chemicals used in interior products that you can just say no to, as there are available substitutions. PVC, also known as vinyl, can be harmful during the manufacturing process. The use of the product when it off-gasses and when it is disposed of is often contains high levels of chemicals that we should not be exposed to. It often contains lead, heavy metals, and other harmful substances. Some companies have vinyl in their textile lines. Some even have entire vinyl textile lines itself. Humanscale does not use PVC in any of our products or textiles, except cables in our legacy electronics. Commercial electronics use PVC almost exclusively for its cables, but Humanscale develops all new electronics without the use of PVC, which is great. So hexavalent chromium, or Chrome 6, is most harmful during the manufacturing process, but can also flake off a finished product. It can be a carcinogen and a reproductive toxin. If you recall the movie, like I spoke about earlier, Aaron Brockovich, Chrome 6 was the pollutant involved. Because of its low cost, every major contract furniture company uses Chrome 6 for exposed, so they use it on things such as exposed metals. Humanscale uses natural polished aluminum. When necessary, we use non-toxic, environmental neutral Chrome 3, which can have a visibly warmer hue, But the main drawback with Chrome's 3 is that it's typically double the cost, which is why it's only used by manufacturers dedicated to healthy materials. Formaldehyde is known as a carcinogen, which can be found in furniture and flooring. It can be harmful during all stages of the product's life. People can be exposed to it not only during manufacturing and disposal, but also in day-to-day use as it off-gasses. All mainline furniture manufacturers have formaldehyde in their wood products, particularly in MDF and particle board, because it's cheaper. Customers are generally unaware that these systems all contain formaldehyde. Humanscale standard tabletops are made without formaldehyde and we do not sell tops with formaldehyde in them. Some companies charge an extra fee for tops without formaldehyde and tend not to advertise this option since it reveals their standard version is made with formaldehyde itself. Virtually every textile sold in our product industry comes with a stain-resistant coating that contains PFCS, which is a purifound compound, also known as C6 or C8, which is a red list chemical. It is a bioaccumulative, that word always chokes me up, and linked to health issues such as cancer, birth defects, and liver damage. Through testing, we found out that this stain-resistant coating, while very effective, wears off quickly. Where it does go, when it wears off, it ends up on people's clothes and in their homes. Humanscale is the only company in our industry not to have any stain-resistant coating on our fabrics. So a halogenated frame retardant were required to meet the California 133 law for many years. Many manufacturers put HFRs in all product lines to avoid the need to manage multiple different SKUs. A collaboration between tobacco and chemical manufacturers pushed for flame retardants in many products. For furniture, it would be often found in the foams and textiles. Fire experts dispute whether these FRs were effective at slowing burn and confirmed that they burn with toxic smoke once they do catch flame. Firefighters are more prone to and more rare forms of cancer because of the toxicity of this smoke. The HFRs in foams and textiles also degrade over time and become dust and can cause health problems for people using the products. It's great to highlight too that the California 133 law is no longer required in California and is rarely required anywhere else these days. And this is a great example of how, change can happen when something negative is highlighted and there is proof to back up why it is not needed. Finding optimized products can be challenging for architects and designers. Initially, each firm would reach out to each manufacturer about each product and keep tracking them each in their own way, often with a series of Excel sheets. This was a lot of work for each firm, asking the questions, a lot of work for the manufacturers, and becomes obsolete each time a product changes or certification changes, which happens quite often. To deal with this challenge, in 2014, HKS developed a system to track and maintain information about products. In 2015, this library grew to include other firms and become what is known as Mindful Materials. In 2016, Mindful Materials Library was put online to provide easy data flow and access. Mindful Materials is free for both manufacturers and for users. Manufacturers keep their own data up to date. Mindful Materials is connected to many certification bodies directly, so often when a certification expires or is updated, this automatically updates on the database, and this means the quality of the data is maintained, which is great. We spend a lot of our time digging into the granular details involved in using healthy materials, which is where we need to focus to make sure the materials are actually better. But it's worth remembering that our main goal is to make beautiful buildings that support our health, and that this needs to incrementally become the new standard. Specifically, healthy materials can contribute to LEED, Volume 4, Well Building and Living Building Challenge certification. The more progress has been made, the more the products will contribute. For example, a product with a published transparency label, so that declare label that I was highlighting previously, could contribute to 1 LEED point. If the declare label has red list free, so it's free of all chemicals of concern, it indicates that the chemical of concern has been removed. It would contribute to an additional LEED credit as well. Recognition of verified products is in the works for all 3 green building programs, and we expect to see additional points for verified labels available soon, perhaps as pilot credits. So I always love to highlight that you have the power to change the industry, especially designers. You make the decisions on what products you include in those RFPs and advise your clients on to look at. So when you ask the manufacturers to disclose what's in their products and to remove chemicals of concern, it sends a clear signal that there's market demand for healthier products. Manufacturers will step up. A good starting point can be to join the AIA Material Pledge. Or if your firm has already joined, find out how you can get involved. The AIA Material Pledge came out of a letter writing campaign between A&D firms and manufacturers. Initially, the A&D firm requested that manufacturers publish transparency labels and remove red list chemicals, which was a powerful request. You know, many manufacturers stepped up to do just that. And then a couple of years later, the manufacturers, represented by the LP50, sent a response letter to A&D asking the preference of healthy materials to factor into the products procured. The next year, an AIA Materials Knowledge Working Group drafted the Materials Pledge letter as a response from the A&D community. This pledge includes a commitment to select and specify products by giving preference to those who have publicly available material ingredients disclosed information, and publicly available environmental impact disclosed information, and documentation of compliance with strict VOC emissions requirements. So in 2012, many firms wrote to the manufacturers requesting material transparency and the use of healthy materials. In 2018, manufacturers wrote a joint reply letter highlighting the progress made in publishing transparency labels and asking to see the impact in specifications. The Indeed community responded with a letter in spring of 2019 with a commitment to prioritize transparency and healthy products in their specifications called the Healthy Materials Pledge. Bless you. The USGBC now offers a program for A&D professionals to become more educated about healthy materials and then be recognized with the Healthy Materials Badge to acknowledge their expertise. And these are just some people that support the healthy materials. This is the senior project manager of real estate at Airbnb, and that's her quote. I'm going to leave you with, when we try to pick out anything by itself, we find it hitched to everything else in the universe. To quote by John Muir. So some takeaways from the CEU is hopefully a better understanding of how materials impact human health and the environment, a sense of importance of transparency in selecting healthier building products, and our responsibility to regulate our own industry, and increased knowledge around key chemicals of concern in the furniture industry and what you can say no to, and empowerment through tools and platforms created by to help navigate this complex, toxic environment. So things such as declare labels, HBD, green screening. That is it.
Well, you went very fast, Alexandra.
I did fly through that. I just looked at the time.
It's a really interesting topic. I would invite everybody who is participating, please write down some your questions in the chat, because we'd love to take some of this time to dig a little bit deeper into this topic. So please do that. I had one question already for you that
Ah,
I'd like to ask and get this, kind of the Q&A started. In your presentation, you talked about Declare, you talked about the product declarations, the health product declarations, and that was all part of the transparency. So an organization, a manufacturer will say what's in these particular products, but just like as you mentioned, the nutritional label, it is up to the user, the specifier, the designer to make that choice then. So if they're looking for something maybe a little bit more, I would say prescriptive. So are there certifications out there, product certifications that have already eliminated some of those really problematic chemicals? So you know for sure this is going to be a safe bet.
so the one that Humanscale focuses on and it makes it clean and streamlined would be the Living Product Challenge. So it's Living Product Challenge certified. So that allows, and it's tied to that Declare label where you can have 1% of like endless chemicals if there's no substitution that's allowed. But Living Products Challenge certified means that if you see that on a product, it means that the 99%, if not all of it, is completely red list free of chemicals. And if it does have a red list chemical in it, it means that there's no substitution for it as of yet. And that's why it's allowed there. And then that Declare label will state it.
Okay, excellent. So that is something that we can feel good about, that that's been properly vetted, and it's not something that we always need to interpret ourselves, because I think just with nutritional labels, it's sometimes hard too, right? Is this good or bad? Even though it's transparent, you don't always know the true meaning of it.
It's true. And I really hope that moving forward, something that I really took away when I was learning the CEU is the fact that there is that 83,000 chemicals, and only 5 are identified as harmful. Whereas Europe is much further ahead in identifying what chemicals of concern they do not want in their products. So hopefully, as we start to push the industry to make a change, maybe I'm hoping that list will grow, because there's no way there's only 5 chemicals of concern out of 83,000. So that was very eye-opening to me.
We have one question in the chat room. Question: what science is available on plant-based leathers? Do you know anything about that?
I do not know anything about plant-based leathers, and I'm actually going to look that up. I'm sorry, I don't know about that plant-based, but I'm curious.
Yeah, as you were saying earlier today, substitutes are not always necessarily better, right? And even though plant-based sounds really good, I honestly don't know very much about that myself. But sometimes there's problems down the complete life cycle of a product, and I'm glad you touched on that. When you were talking about things like chrome, right? It's
Yes.
Sometimes a material in use can be fairly safe, but in its life cycle, the mining of, the processing of, I know chrome plating is a really energy intense process. It's very often still done in countries where the working conditions are less than safe. People without masks on and just with their bare hands dipping things in metal pieces into chromium baths. So those are things that are also very important.
Yes, no, it's very eye-opening to think what off-gases Chrome-6 and even formaldehyde in tabletops. I had no idea that, I'm looking over at the desk that I have, it probably has formaldehyde in it. And that's something to, be aware of. And hopefully, again, we can push for change. Like I highlighted, our tops, the way that we get around not having formaldehyde in it is they're made from bamboo. So, you have to find alternates to that.
Yeah, and I know the industry for a long time has already been looking for alternatives. The challenge was sometimes scaling it, right? It's hard to do. I remember talking to someone once about a wheat board was for a while a popular replacement, but then they discovered that there was a chemical that was used in there that people could get sensitive to in the manufacturing process. So then that was sort of like tossed aside. Even though there was not any major off-gassing.
Yeah.
So that's always it's always a challenge, right? And maybe we want to be less harmful. Is sometimes our goal instead of no, because it's almost impossible to find everything 100%. Right. So just wanted to see if there's any further questions from our attendants or attendees. Okay, I'm not seeing anything show up. Yeah, I could probably talk to you for hours about this topic. I'd like to say that it is, because it's complexity, we love to work with designers, clients, the manufacturers we represent, and find those right solutions. It can be really, it can be a challenge sometimes. We really want to help out. I have been involved now in a few well projects. You do want to help out, but by all means, I think what's very important is that we have that dialogue going back and forth. What's the expectation level? If are we working towards a building certification? And what's the compromise? Because sometimes we do need to provide solutions that meet the environmental guidelines, and it may not be the exact aesthetic, or may not have the exact performance. So that is, of course, always the balancing act as well, as we're trying to work with our clients.
Yes, and I just one takeaway too for designers would be definitely check out the Mindful Materials library if you haven't had a chance to. I think there gives a really great overview of products at a glance that you might not be aware of that fit certain criteria. So I always think you're right, John Paulo, it can be a little overwhelming to know exactly where to go and lean on ourselves in the industry to help guide you if that's important on that project or to your client. But Mindful Materials as a general overview, just I know as being a designer myself, I like to be as informed as possible and kind of have some ideas in my mind of the go-to products. So I think that site is a great one for manufacturers to use, and then also for designers to leverage for their different projects and opportunities.
One thing I wanted to ask you, kind of close this off, is we talked a lot about materials in products. We didn't really touch too much on the end of the life cycle. We all think recycling is a good thing, but especially if we're recycling older products, they may not have the best materials in them. I think that the question is, do you want to recycle these products, or maybe we just have to somehow dispose of them
safely, yeah,
in a responsible way, but not really reuse those materials, because they may have toxins in them, even though they are recycled.
I agree. Yeah, it's having not everything might not make sense to repurpose, or exactly identifying how to recycle or dispose of them correctly so they don't disturb the rest of everything that's getting recycled in that pile, or it doesn't off-gas and all of that. So yeah.
Excellent. Okay, I don't see any more questions, so I assume your presentation is very clear. We are giving you back 15 minutes of your time because we are at 12:45 now. So I would like to once again thank everybody for joining us today. Again, just a quick reminder that we will have our next webinar on June 2nd, and that again is the Biophilic Design Nature in the Workplace. We will be sending everybody a survey, and we ask you to please complete that survey. And it's really important for us to learn more about the topics that are of interest to you, so we can plan the future webinars for you. Alexandra, thank you so much. Really appreciate it.
Elliot, I will follow up if I get any information. I took a picture of your email, so yeah, I will follow up.
Great. I just made a note, but thanks that you already took care of that. Thanks everybody for attending today. As always, really appreciate it. And I wish everybody a great afternoon.
Thank you.
Have a good one. See ya.
Bye, everyone. Thank you. Happy Friday, Junior.